Hello, I'm Health and Human Services Secretary Alex Azar. It's a pleasure to share a message on the occasion of National Rural Health Day. I want to offer special thanks and congratulations to the National Organization of State Offices of Rural Health, which created this event 10 years ago as a way to highlight the creative and innovative spirit we see from all American rural health care providers. As part of this year's event, this coalition of state rural health offices has recognized 48 community stars from around the country. Americans on the front lines of providing health care in rural parts of our country, as my father was, are heroes on any given day. But this year, they've also taken up the additional challenge of responding to the COVID-19 pandemic. And I want to thank every rural health provider who's played a role in that. Many of these community stars are also HHS grantees working in rural health clinics, community health centers, and critical access hospitals. Some of them have received support for their training through the National Health Service Corps. Others have been part of HHS-supported efforts at improving rural health care quality. Our hats are off to all of these community stars and to every dedicated rural health care provider. Rural health issues have a special importance to me as I grew up in rural eastern Maryland. I'm proud that under President Trump, we've put a new focus on rural health as an impactable challenge where we can make a real difference. For the past 3 years, we've had a rural task force hard at work on ways to deliver that transformation. In September, we released the HHS Rural Action Plan, which laid out a 4-point strategy to guide our work. First, building a sustainable health and human services model for rural communities. Second, leveraging technology and innovation. Third, focusing on preventing disease and mortality. And fourth, increasing access to care with a particular focus on strengthening the rural workforce. The Rural Action Plan highlighted key accomplishments across HHS over the past 4 years and identified a number of new efforts that we supported in 2020. I'll mention just a few major highlights. As part of an ongoing initiative to focus on rural cancer control efforts through the National Cancer Institute, we've delivered more than $11 million in new funding. We reduced regulatory burdens for rural providers in Medicare and addressed challenges of rural hospitals in low-wage areas through targeted adjustments to the Medicare wage index. We've targeted more than $300 million to address the opioid epidemic in rural America through HRSA's Rural Community Opioids Response Program. We began the nationwide expansion of the Indian Health Service's Community Health Aid Program, which I've had the chance to see in action in rural and remote tribal communities in Alaska. The Rural Action Plan came in response to President Trump's August executive order on expanding access to telehealth and improving rural health care. Since then, in response to the EO, we also reached a new memorandum of understanding with USDA and the FCC to work jointly on a rural telehealth initiative, and we proposed a new payment model to transform rural health care delivery. We're keenly aware of the important role that rural hospitals, clinics, and state offices of rural health have played in response to the COVID-19 pandemic. We've sent more than $180 million specifically to support rural hospitals, expand telehealth, and assist tribal communities during the pandemic. We've also made sure that rural hospitals and clinics were able to receive more than $11 billion in support through the Provider Relief Fund, helping to keep them open at a time when many have faced serious financial challenges. Our goal for rural health in America is not just to expand access to care and improve health. It's to drive a transformation of rural health care so that we can have a better, sustainable model that draws on the insights of rural communities themselves. That's why it's so fitting that this National Rural Health Day emphasizes the power of rural. We're eager to continue working with you to maximize the power of rural America and draw on the innovative spirit you bring to your work. Thank you for your efforts on behalf of rural America, and keep up the good work.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.
Hello, and thank you so much for making me part of this important day. Michelle and Terrell, I appreciate all the work you have both done to turn National Rural Health Day into a high-profile, meaningful event that gives someone like me a terrific opportunity to connect with an audience that matters. Everyone participating today cares so much about rural health. We all know the challenges, we all know about the opportunities, and we all see that health and prosperity are absolutely intertwined, and we all want both for rural communities. But we don't always know how to make the biggest impact, how to really change the most lives and quickly. USDA has so many programs available for rural, tribal, and farming communities that one of our greatest challenges is simply making sure that the people who could benefit from our programs actually know about them. That's where partnerships come in. Each and every one of you watching today, in my view, is a current or future partner of USDA's rural development programs. Your knowledge of local needs and opportunities is the first step towards solutions. I can tell you that all of our success stories begin with local leaders, people who know their community and understand its needs best. And I am proud to say that those people are often part of the rural development team. Our state directors and state teams are amazing. If you don't know them already, please make it a point to reach out. You can find their contact information through our website at rd.usda.gov. Our state teams are the best people to tell you how our programs increase prosperity and economic opportunity in rural America. We like to say that we can help build communities from the ground up, and they are 21st century communities, which is so important when it comes to health. Here's how we do it. We provide financing for rural Americans to buy or rent safe, affordable homes. We connect those homes with electricity, with clean and healthy drinking water, and with high-speed broadband service, something that is essential for prosperity, education, and wellness. We also provide financing for rural businesses and cooperatives to spur job creation and economic growth. And we invest in facilities that make communities work. That includes schools, libraries, police and fire protection, and it also includes resources for health services from rescue squads to hospitals. For example, when the city of Peru, Nebraska needed a replacement for one of its 2 ambulances, we were able to provide financial support, about half in the form of a grant and the other half in the form of a loan to buy a new vehicle. Because the new ambulance is 4-wheel drive, the Peru Rescue Squad is now able to help more people during inclement weather. Another interesting project involving a critical care vehicle is the Hope One mobile unit in rural New Jersey. This facility on wheels was born out of a partnership with a nonprofit foundation, a sheriff's office, and a local health system. We provided a $134,000 community facilities grant for the project. The plan was for Hope One to be staffed by medical and law enforcement personnel to provide recovery services to people struggling with opioid addiction. But when Hope One was ready to roll, the COVID-19 crisis had become a priority. Like so many other people and organizations during this time, we adjusted our plans and shifted our priorities. The Hope One team quickly adapted to the new circumstances and was unveiled in April as a COVID-19 Atlantic County testing site. That story reminds me of how innovative rural communities are. They say that necessity is the mother of invention. That's a small town expression if I've ever heard one. Perhaps the most important thing USDA Rural Development is working on right now is access to broadband. By providing grants and loans for construction, improvement, and acquisition of the facilities and equipment needed to provide broadband service in rural areas, Our Reconnect program is making an historic difference to make sure Americans have access to this essential infrastructure no matter where they live. You know how much broadband means for rural health care. Telemedicine is a game changer for people in small towns and remote locations. It delivers care that is faster and more sophisticated. It levels the playing field of health in a way that is unprecedented. I hope you will work with us on delivering broadband, ambulances, and whatever else you know your communities need. We are your partners, and we deeply appreciate your leadership. Thank you. Have a great Rural Health Day.
Happy National Rural Health Day, everyone. It's so great to see the engagement of the Secretary of HHS and the Undersecretary of USDA involved in understanding the leveraging of resources. But even more importantly, we love to see the Community Stars story. They are all just a fascinating study in leadership, in innovation, and commitment to community, which is exactly what National Rural Health Day is all about, and this session is all about. We're coming to you live today, and that's bold of us. We hope that you will engage with us during the session and on through the chat. If anything happens during the session, we want you to know that we've learned a lesson from 2020. Always have a backup plan, so sit tight. We have a backup plan, and we'll come back to you quickly. I love National Rural Health Day. It really is a great day to shout out about the good work that's going on around the country. But my real privilege every day is to serve the 50 state offices of rural health around the country. Today, I hope that they're getting a break from their responsibilities to serve rural providers by crunching data and being called into public health emergency teams and meetings to shout out about that good work. We see them making awards, offering activities in their state, and coming alongside their governors with governor's proclamation. Never at all did I imagine when I looked when National Rural Health Day started more than 10 years ago, did I think that on this 10th anniversary of the observance of National Rural Health Day, that we would be dealing with a public health pandemic. It is such a great honor to call attention to all that is positive on National Rural Health Day and to bring attention to that. So it is the 10th anniversary. When we started small. I was on a street corner with Karen Madden, the No SOAR past president. She's the director of the New York State Office of Rural Health. And we looked at each other and she said, hey, we should have a National Rural Health Day. And so we began. And in the beginning, we started with answering the phone, having National Rural Health Day, and being thrilled when people shared their success stories with us. It's grown over the years. We've had the pleasure of presidential greetings on National Rural Health Day. And as you can see today, we see a full engagement from federal agencies, not just USDA and HHS, but we're proud to see CMS and CDC, thank you, Diane Hall, and others to join into this effort. And we're very, very proud of that. We can't do any of this work without those partnerships. Today, I'm really proud to share with you that this week we received and have earned over 50 million impressions as of Wednesday on Twitter. So it's a big social media campaign. We've taken the day, the moment, and moved it into a movement. And we've done that through the hard work of our team and through the work of Impact Communications, Michelle Rathman and Sarah Reiser, who are behind the scenes today, really have a vision and the creativity and the capacity to help us grow this movement. And we're very proud of our work with them. We can't do any of this work without our partners and without the expertise of our partners at the Federal Office of Rural Health Policy. We also are very proud of the investments that our investing partners at the Center for Optimizing Rural Health at Whiffley and Stroudwater Associates lend to us with their investment in our mission. All of that is done with heart. And that is what National Rural Health Day is about. So today we are going to focus on what is so important to state offices of rural health and to all of you on this call. We're going to focus on community, and we're very proud to focus on 100% community. Last year, you might remember that on National Rural Health Day, we were treated and featured the work of a film called The Providers, which focused in on the work of El Centro Family Health Center in Las Vegas, New Mexico. Through that, we met Matt Probst, who's their Chief Clinical Officer, and we are very proud to be a part of that. We learned earlier this year that Matt's been involved in a project that he's really seen take off, and we think it's a game changer in terms of responding to people's needs right now to do something. This work has been inspired by two books, a book called NRHD and 100% Communities. And I hope that you have heard two things. One is that if you missed the film, The Providers, I hope that you'll catch up with that. That is posted on our website at thepowerofrural.org. And so our chapters from 100% Community. The authors have made, very generously made chapters available to you at the Power of Rural website. So I hope you'll take advantage of that. In just a minute, I'm going to welcome the authors, Dr. Katherine Ortega Courtney and Dominic Cappello, along with Matt Probst, to come and share their experiences and their guidance in really making a difference for rural communities. But before that, it is my pleasure to show share an opening message from New Mexico State Senator William Soules, who was instrumental in supporting the 100% community effort in New Mexico.
Thank you for the invitation to address you today on National Rural Health Day. I'm Bill Soules, a state senator in New Mexico and the sponsor of the bill that funded the NRHD Institute for the Prevention of Child Abuse. As I start, I want you to think deeply about the question, how many children should we allow to go hungry each night? How many children are we comfortable with being homeless? 1%? That isn't that many, right? Well, in my community, that's over 300 children that go hungry and/or homeless every night. Most of us think that number should be 0. The real question is, what are we going to do about it? How do we get 100% of our children in safe homes where they're fed and well cared for? About 2 years ago, I was teaching high school, and I asked my students these tough questions. But the toughest question they asked back of me, why haven't you done anything about it? I didn't have an answer for them. Certainly wasn't the child's fault. That challenge is what motivated me to work with the authors of the book, Anna Age 8, and to use my position as a state senator to get the New Mexico legislature to fund the first of its kind Anna Age 8 Institute for the Prevention of Child Abuse. So today, I pass on the same challenge. What are you going to do to ensure that 100% of the children in your rural communities are going to have the survival and thriving services they need? The two books, Anna Age 8 and 100% Community, lay out how to do it, but it requires people to make it happen. Be the person in your community to make it happen. 100% of our children deserve it, and you are the one who can make it happen. Thank you.
I love that message. We can make something happen, and we see that every day through the work of the state offices of rural health. But now it's my great pleasure to introduce you to Dr. Katherine Ortega Courtney and Dominic Cappello. I'm sure they've been instrumental in engaging Senator Soules in this effort, and congratulations to you. That's a big piece of this work, is our opportunity to engage policymakers. Let me tell you about Katherine and Dominic just real quickly. They are advocates for turning crisis into opportunities, for improving systems, solving challenges, using data, technology, and collaboration. They know why systems that should protect us can fail us, and they are involved in the teaching of leadership development and data-driven problem solving. That's very important to us at the state offices of rural health. Dr. Courtney's experience in data analysis, continuous quality improvement, collective impact, and experimental psychology guides that work of communities and organizations through turbulent and timely change that is so needed right now. Cappello is not just a very friendly guy, but he's a health systems strategist and a New York Times bestselling author whose 10 talk book series on family safety reached a national audience when his innovative work was featured on the Oprah Winfrey Show. Together, they got together and watch what happened. They co-authored NRHD and 100% Community, ensuring 10 vital services for surviving and thriving. These books and this framework that you can use inspire us to call to action. They call on us to collaborate, to innovate, and that is what's needed to end adverse childhood experiences, to end trauma, to address social adversity, and address health disparities that are so important to us. And isn't that exactly what we need in 2020? We're so happy to have you with us here today, Dr. Courtney and Dominic. And with that, I know everyone is excited to hear from you, and please take it away.
Thank you so much, Terrell, and congratulations on the 10th anniversary of National Rural Health Day. It really is such an honor to be here. Before we get started, let's take a minute to do a quick polling question, and hopefully everybody's had a chance to review the free 100% community chapters, but if not, that's okay too. If you had to guess right now, how many people in your county have access to the vital services they need to survive and thrive, what would that be? And you'll have some options to choose from. And as you ponder that, let me talk a little bit about a community that we surveyed, which also happens to be the community that Matt Probst and I grew up in, which is Rio Arriba County in northern New Mexico. So we collected some data about a year ago from our 100% community survey. And we finished collecting surveys right before the pandemic hit. And even before then, there were significant gaps in services. And as we all know, these services are more important than ever. So just as a quick snapshot of what kind of data we saw for medical care, of those reporting needing the service, 29% reported difficulty accessing medical care for either themselves or for their children. For behavioral health care, 46% of those who reported needing it reported difficulty. And in addition to asking about access to the service, we also asked what are the barriers. So for behavioral health, some of those barriers included things like waiting lists, cost, no quality services available, and also transportation, which was a running theme through all of the services that we saw. So in other services, food, of those who needed food, 32% reported difficulty accessing that service. Of those who reported needing housing support, 66% reported difficulty accessing these programs. And as far as transportation, 51% reported difficulty accessing transportation services. And as I mentioned, this was a common theme in all of the services, and particularly in rural communities, transportation is absolutely vital. So before we dig into how we're going to address those gaps, let me back up a little bit and tell you a little bit about our history. So as Terrell mentioned, Dominic Cappello and I are a team, and we've now been working for the New Mexico Child Welfare System. We were in the Data and Research Bureau in New Mexico, and we bonded over a shared passion for improving systems as well as big picture thinking. While working for child welfare, there was a terrible child fatality that happened while we were there, and the response and the fatality were both particularly upsetting for us. A child who had been in and out of foster care her entire life was returned home to live with her mom, where her mother proceeded to beat her to death at the age of 8 years old. The aftermath of this case was the catalyst for Dom and I to write our first book, NRHD, which was really a call to action against childhood trauma. While researching solutions for child welfare and through the work we were doing in the state and throughout rural counties in New Mexico, we realized that the problem is so much bigger than the scope of child welfare. We heard story after story about parents not being able to access the resources they needed, whether it was access to behavioral health services or food services. It was a running theme with every single county we talked to. This, along with research on social determinants of health, led us to recommending in NRHD that every family needs access to 10 vital surviving and thriving services. After reading NRHD, a city councilor in Las Cruces, New Mexico, called us up and said she wanted to implement the recommendations we made in her own community. She started doing that by pulling together members from each of the 10 sectors we're going to talk about today. Soon after that, we started to hear from other communities who also wanted to implement our initiative. And Senator Bill Sewell was able to pull together funding from the New Mexico legislature to start the first of its kind institute focused on the prevention of childhood trauma and social adversity. While all of this was going on, Dominic and I realized there was a need for more in-depth manual on how to implement 100% community. And in that book, we outline exactly what every county stakeholder can do to come together to ensure that everyone in their county, 100%, have access to the 10 vital surviving and thriving services they need. As you can see in our organization chart here, this model involves stakeholders from all sectors, including elected officials, nonprofits, the business community, and government agencies. This allows everyone in the community to come together to really share a vision. We also support action teams in each community for each of the 10 sectors. The survival services are medical care, behavioral health care, food, housing, and transportation. The thriving services are parent supports, which includes things like home visiting, childcare, and parenting classes, early childhood education, community schools, youth mentoring programs, and job training services. And when we talk about job training, we mean jobs that are real and that lead to real jobs in their communities. So we want to make sure that the education systems are aligned with actual jobs in the community. After fine-tuning and tweaking our model over the last few years and working in many counties in New Mexico, we've developed 7 steps toward ensuring access for 100% of individuals to 10 vital services in every county. And my co-author, Dominic Cappello, is going to walk you through those steps now.
Greetings, and thank you for having me. It's a pleasure to be here talking to you from Santa Fe, New Mexico. And as we all know, everyone on this call knows that we've been facing health disparities in rural America for many, 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 many decades. Add to that a pandemic, add to that economic freefall, and now add to that childhood trauma. This could be overwhelming for any county. And I should mention that our model, 100% community, is a county model. We work county by county. But if you want to do something groundbreaking, if you want to do something that has never been done before, if you want a framework for getting to results, then I'm going to take you on a journey. These are 7 steps every county can take, working as a team, and we are here to support you 100% through this process. All right, step number 1. As Dr. Courtney said, you're going to survey your county residents. We have a whole process to make this very, very easy. We look at a map of your county. We look at all the communities and towns and maybe even some places that aren't on a map. And we go there and we survey your parents and your caregiving grandparents and your youth to find out to what degree do you have access to the services for surviving and thriving. Again, we have a process set up that'll make it easy for you to implement the survey. Step number 2, this is where it gets interesting. As Katherine has said, you will have 10 teams, each team representing a sector, like the food sector or the behavioral health care sector. The teams will now look at the data and they will analyze it. And this can be a little more, this is a little more complicated, but again, we're here to support you 100%. But you're going to be diving in because in many ways, the data will provide you with the insights, because when you look at your county map and you look at every community, you're going to be able to go, wow, now our major city in the county, look at the disparities, look at the barriers, look at the gaps, and look at the reasons for the gaps. But you're going to look at that map again and go to a tiny little village of 200 people and go, interesting, different gaps, different barriers. So what we need to do as a team, county by county, is do a complete analysis. With that done, you're ready for step 3. This is where you check in with all your providers. Again, back to action teams. The food action team, they're going to be in contact with everybody in the county who's doing food security programs and checking in with them, asking, how are you doing? How are your resources? Are you meeting the need? What are your challenges? How has the pandemic impacted your services? What are your aspirations? You collect this up, and now your county has a real picture of what's available and what could be available. Okay, with that information, step 4, and this is kind of a fun one. We have the technology to make it very, very easy for you to make a directory. Now you may be saying, hey Dom, why do we need a directory? We have 1 million directories. And if that's true, if you have a directory to the 10 vital services for surviving and thriving, bravo. Is it updated? COVID has changed all our services here in New Mexico. Some are greatly diminished, some don't exist, some have grown and offered online services. But the point is this, our directory has to be state of the art. We will not send a single mom with 2 kids to that directory to find out the wrong hours for a food pantry. So a directory doesn't just sit there. It is curated and it's checked in by all 10 action teams. All right, let's go to step 5. Identify innovative policies and programs to fix the gaps, to fix the barriers. In our book, 100% Community, you will find sector by sector, 20 to 30 innovations that will reduce gaps and reduce barriers. We've done the work for you, or we've done the initial work for you. It's not the be all and end all, and we have a website that we're gonna be constantly updating to give you even more innovations. But this is your starting point. So you can go to 100% Community, the book, and get lots and lots of ideas. But this is where your action teams are working together. And again, they're tracking back to the original data. If people in your community said, we can't access the food pantry because of transportation, then you're going to be looking for innovations that have shown how to deliver. And here's the good news. For any barrier you find, for any gap you find, there's already a solution somewhere. So that's the work that you're going to be doing there. Step 6, now this is where it gets really interesting, because our 100% Community Initiative team members are not living in their own world. They are in a world with city government and county government and actually school board members. They are interacting and building or strengthening relationships with all the key players in the county because everyone comes together. Some of these innovations can be done without cost. They're changes in protocol. Some of them will require funding. This is why you have to have buy-in. And we learned a lot. I do want to do a shout out here to Las Cruces City Councilwoman Cassandra Gondra, who really taught us what it's like to be on the city council, what it's like to get pitched ideas. And so she gave us incredible ideas. And of course, she's leading in Doña Ana County, her own initiative. But we've gotten really good insights from lots of leaders on how to collaborate. And lastly, we evaluate. This is not the kind of initiative you take on if you just want to get together and convene and talk. This is the kind of initiative you take on if you want to get to results. And so we measure year by year and through the year. How are we doing as an action team? How are we doing as 10 action teams? How are we doing as a county? And we have the tools to help you do this. So these are our 7 steps. And as I said, we have lots of expertise here. If you want to know, well, how is this done? How does this work? What are the challenges? Listen, I can connect you with Diego Lopez in Rio Arriba County, and he can give you lots of ideas about challenges and opportunities. As I said, Cassandra Gondra, a councilwoman, she's got amazing ideas out of Doña Ana. In Socorro County, where we have what's called Tech in Town, we have a world-class engineering university and the town, and we're working to bring them together. Dr. Sharon Sessions and JC Trujillo can tell you a lot. I could go down all our counties, but you need to get a hold of us, and we need to connect you with people who are actually doing this work today. One thing I'd like to say before I do an introduction of one of my most favorite people on earth would be to have you think about Hercules. Think a little bit about, I think, the Disney cartoon, although Hercules has been in lots of movies. Do you remember when he had to battle the giant dragon, actually called the Hydra? And the Hydra can have 3 heads, 9 heads. And so you have a hero with a sword, and you have a giant Hydra with many heads. And the moment you cut off a head, another one grows. I'm mentioning this to you because this is the story of 100% community. Ideally, you are the heroes. You are Hercules. But we want to warn you, there are 3-headed hydras out there. There are people who are going to say, yeah, this sounds like a good idea, but I don't think we're ready for it. Or it's too much to take on. Or why don't we wait for the pandemic to end, and then we'll talk about increasing access to medical care. Katherine and I have talked a lot about this. As a matter of fact, if you want a graphic novel, we've cartooned it out for you so to prepare you for the 3-headed hydras that you will be confronting. But this job is mostly about connecting with heroes. And everyone on this call is a hero. So what we need to do is to connect all of us. And on that note, one of my favorite heroes is Matt Probst, who has been mentioned earlier, a participant in the documentary, The Providers, which I would recommend you see, and medical director, chief quality officer of El Centro Health Clinics in San Miguel County, where we have one of our initiatives. And I do have to tell a quick story about him, because when he called a year ago, almost literally a year ago, he said, what do I do? How do I get into 100% community? And I said, we've got a little book for you. Very little, very little. It's, not more than 650 pages. And he goes, great, send me the PDF, I'll read it. And I thought, Katherine and I, we went, this guy's so busy. We'll hear from him in half a year. And I believe it was about 10 days. I know he had some flights to make. And so he called me back in 2 weeks, said, I've read the book. Now what do I do? And I'm like, you read the book? And he read the book. And I said, well, you're going to need 10 action team leaders. Can you find 10 or two to guide the teams, each team? And he goes, I can do that. And I turned to Catherine and I said, this guy is so busy. I really do think that that's a half a year project. And within 10 days, he sent me an email, and he had the bios of people who were really interested in being part of this. So the point of the Matt story is, if you're ready to go, it's go time. So on that note, I hand you over to Matt.
Oh, thank you, Dom. I'm so happy to be here with you guys again this year. 2 years in a row, what a pleasure for me. Welcome back to the Probst House. For those of you who have seen the Providers documentary, this may look familiar to you. The Probst House is now also serving as 100% Community San Miguel headquarters. It also serves as first grade Spanish immersion class for Senora Probst, and the classroom for all 4 Probst boys, from the film, and the telehealth clinic for me in terms of what I do in terms of still seeing patient care when I'm working from home doing telehealth and not able to go into clinic to provide those services. So, wow, COVID has changed so much for all of us, It was an interesting 2019. So yes, I got to share with you all last year. We had our own call to action. And when I say we, I mean all of us. The Providers documentary really gave that call to action and told our plight, our crisis of rural healthcare in America. And so for me, that became an opportunity to be a spokesperson and travel the country. I traveled more in 2019 than I had my whole, rural homegrown life prior to that, and told that story. And not just told the story, but said, we need resources. In rural America, we are not underserved. Get rid of that word. That's not true. We serve with everything we have, and all the innovation you heard about earlier. We do so much with so little that it is amazing. So we are not underserved. We're under-resourced, and to be able to be screaming across the country to everyone that would listen, and to use that stage to say, we need resources. Not because you feel sorry for us in rural America, but because you look at what we do with so little and the innovation that we do. And we are amazing. And with more resources, wow, the difference that we could make in the lives that we could save. So that was my job. I will tell you, as 2019 came to an end, I had a real empty gut feeling as I traveled the country and did that for all of us in rural America. Coming home, and lots of trophies on the wall. I won a lot of awards in 2019, lots of recognition, but a struggling community here at home. And nothing had really changed at home. And, you know, to me, that was the point of opening myself up for the providers documentary, is for it to make a difference here. And nothing had changed. And so I looked at those awards like trophies on the wall, but with my gut hurting and that empty feeling, in all honesty, knowing that there was no food on the table, there was no meat in the freezer, to use a hunting analogy, to feed my community that was starving for access to services. So along comes Dom and Dom and Doc, Dr. Katherine, with their own call to action. Anna, age 8, and telling that story of something near and dear to me, my passion being youth medicine, and realizing, okay, what can I do? What can I do here for my home community as I come home? How can I now focus on home and do something with what we've got here in resources? And so there's where 100% community comes in. And so you start with a call to action, and then you have a plan of action. Yes, a very big textbook. And so, yes, we rallied, and the groundwork that had been done here, because healthcare is a relationship, and that's something we do so well in rural America, is we network, you know. And so I already had champions in all of these sectors and more, as we had been working to really work on substance misuse, and including that upstream prevention of substance misuse and youth work. My co-director, Sheriff Lopez, you know, immediately said, give me the book. He read the book and he's like, we're going to do this. And we had city councilors and county commissioners and school board members and higher education presidents and just local folks with a passion, and so many that said, yes, I want to do this. This is a plan of action. This is what we need. And so we went through the book together. We had book club, literally went chapter by chapter through the books together, and started preparing ourselves to attack this epidemic of childhood trauma. And lo and behold, just as that book club was coming to an end, COVID hit. And this guide, this plan of action, being evidence-driven, informed by crises, could be applied to any crisis. And so we said, it's time to shift. It's time to get to action. We had a call to action. We had a plan of action, and it was time for action. And we knew that COVID would make childhood trauma much worse. And so we needed to do something. And so we mobilized. And with that mobilization, 10 action teams got to work and started working together to weave together services. So as said earlier, there are 10, 5 thriving, 5 surviving. Now, the beauty of that, this is probably not anything that you don't recognize in social determinants of health, is when those action teams, you start getting cross-sector collaboration and you start weaving together those services. You start talking about getting a strong safety net. That was the beauty of it. And so for me, you know, my area of expertise would be medical and dental action team. And so there are 5 surviving services. Medical dental is 1. And what we know now is that that's history, a part of a national success story. We mobilize not just here locally as healthcare providers, but in collaboration with the New Mexico Department of Health, to not just here in San Miguel County, but across the entire northeast region of New Mexico, to set up rural and frontier COVID testing sites. So I was able to serve and help set up 18 of those testing sites, not just in El Centro, but with sister organizations like Mora Valley Community Health Center and Las Clinicas in Tierra Maria, New Mexico. Places that maybe you wouldn't recognize on a map. I know Santa Fe may be familiar, maybe even Taos or Las Vegas or Espanola from the film. But when you get to real rural, to frontier rural, we needed access to those testing services. So we did that as a region, and wow, to have access to testing is beautiful. We were able to set that up, and I think that a lot of the success that we've had to date in terms of being able to hold off COVID this long is because of that. It's not an accident that there's 8 counties remaining in New Mexico that are less than 5% test positivity, and 6 of them are in the Northeast region. That's thanks to 100% community work. We have 100% community testing schedules for all of our testing counties that we share with residents, so they know where they can access those services. But that's really just step one. Step one of a country 2-step medical action response. So yes, there's preventing COVID. And we know with preventing COVID and preventing any disease, it also has to be early detection. So testing is awesome. Having communities come together and saying, we're going to practice COVID safe practices to prevent COVID, right? And joining forces across schools, across businesses, across all sectors, not just health, to say we can all do something. Everyone working for everyone is what 100% community is about. That helped greatly. And that other part of step one, having surveillance testing and being able to have access to that service helped greatly. But it's a country 2-step. And so to country 2-step, you need step 2, as we all know. And so COVID testing and preventing COVID is great. But then what do you do next? You got to be able to respond to COVID. And so building that capacity is something right now, as along with the rest of the world and the rest of the country, we are under siege, and positive tests are on the rise for us that we need now more than ever. And so we've mobilized. So a very important component of responding to COVID is contact tracing. So in El Centro, we have our goal that for any patient test results that come back via interface, a lab interface, that within 8 hours of that result dropping into the interface, we've given the patient their positive results. And almost all the time, that's within 4 hours, actually. We exceed our goal. Beyond that now becomes not just telling somebody they're positive, but providing their healthcare. And beyond providing their healthcare is saying you need to isolate. And do you have the services that you need to isolate? Do you need food? Do you need food delivery? Are you homeless? And I'll get into that more. But you need to be able to meet the needs of those folks, or they can't isolate. And then with contact tracing and contacting all those close contacts, same things. You need to quarantine for 14 days. You need to be tested. Community health workers asking, and what do you need? What can we help you with? How can we provide the access to those 10 vital services? So you see, it's not just medical and dental action team. Then comes in transportation and food and housing and et cetera, et cetera. And just that point that what we saw here in New Mexico early on in our Navajo Nation in the Northwest region is social determinants of health, and what we know that your zip code should not determine your life, but it does. And if you don't have access to running water, how can you wash your hands? And if you don't have access even to electricity, how can you have bandwidth and telehealth? Even if you don't have a phone, how can you have telehealth? And if you don't have a home, how can you stay at home? So there we go to housing. So again, there are 5 surviving services. And so as we move on to housing, that's really what I want to say. We have a lot of work to do in that area. And it's, trying to say it's as easy as go to the homeless shelter. How do you socially distance in a homeless shelter? That's a struggle, the way that they were originally built. So we've got a lot of work to do in housing, and of all the areas of access to 10 vital services, that's probably our greatest need right now. And so we continue to work. We'll have a meeting tonight with city and county combined government on one call tonight with the city of Las Vegas and the County of San Miguel, thanks to the leadership of our mayor and county commissioners and city councilors coming together to address those types of needs. So there we have it. The piece that fits most easily for me with 5 surviving services is the partnership between medical, dental, and behavioral health. For those of us out there in community health centers, we know we do all of that. We do all of that, including the social determinants of health and the health education. But mental health response right now in this pandemic is huge. And lack of access to those services is equally deadly to COVID infection. And so in my own home community, this week, we've lost two 13-year-old boys to suicide. And can't just say that, can't just skip over that. That's what we started to come together for, was to prevent that and to end childhood trauma. But with COVID, it's just so much harder to reach them. And so our mental action team is doing just that. How do we reach out in a time where we don't see these children physically at school right now? Their home visitation is limited. You know, we have fewer CYFD referrals. How do we get to them? So, you know, again, in partnership with our state of New Mexico and the Office of School and Adolescent Health, we have a weapon. It's called Just Health. It's a screening tool. It's app-based. And so we are committed to screening every child in San Miguel County and every child in public school in San Miguel County with this screening tool, which really asks questions not just about mental health, but access to all vital services. So we got to get to them. And that's in partnership with our local schools and the state of New Mexico. Those same Chromebooks that are delivering education in the Probst classroom here today as I speak can be used to provide those services in the follow-up medical and mental health care that's needed when they screen positive. So if they're not reaching out to us, we need to have a tool to reach out to them, and we are launching that weapon with everything we have right now. It was too late for these 2 young boys, but it's not too late for others. So that's how this works, you know, and again, mental health there can't be alone. It's got to be in combination with education and others. And so that's enough of me speaking. I'm going to hand it over to my partner, my neighbor, literally my neighbor, Dr. Peter Skelton, to talk about food.
I'm Peter Skelton, and I am the food team leader for the San Miguel County 100% Community Initiative. The food team's an essential element of the 100% community because we are the team that's working hard to make sure every family is fed and food insecurity is reduced throughout the community. The basic survival of those most in need depends on access to food. To build our action team, we identified the key players in food distribution, food production, policy, higher education, and business, and asked them to be part of our movement. This has been an ongoing process with new members joining our team, say for instance, our school district student nutrition directors, because they play such an important role in feeding youth. Due to the pandemic, we were pressed to quickly respond to increasing food needs in our community that were a direct result of becoming newly unemployed or underemployed, in addition to those who had chronic needs. As a result, we quickly assessed food availability in the community and developed a resource guide to increase awareness about where a person could go to get fed or get food. This also helped us with our gap analysis to identify holes we needed to plug quickly. In sum, 100% Community provides the essential framework to bring disparate groups together that work to provide grassroots, innovative community solutions designed to ameliorate problems associated with health, safety, and food insecurity.
Well, what I've done is using the book Anna Age 8, I strategically placed that book with community members that I know impact transportation. And we've had many one-on-ones with leaders in our community that understand transportation. So that could be our transportation directors at the county and the city level. It's also speaking to city and county commissioners related to the importance of transportation, ensuring that appropriate funding is going to transportation. If there's gaps and barriers, that we're speaking to that and understanding what it's going to take to mitigate those gaps and barriers. And so for me, it was utilizing one-on-ones with folks, but also participating in public transportation. I spent a week on public transportation here in Las Cruces, understanding the routes and where they take me, and calling the particular hub, right, that provides transportation, asking necessary questions, all while, of course, they didn't know that I was calling as a city councilor. I was just calling as a private citizen. And I have to say, they were remarkable. They were encouraging. I think they shared a little bit of my concern, or understood the concern about making sure I was getting from point A to point B timely. And they said, if you ever have any questions or concerns, give us a call. And so it gave me a wonderful perspective of our transit system here in my community, but it also gave me a deep understanding of the gaps that we have.
So there you've got it. 5 surviving services. Now we'll move into the 5 thriving services. And I have to be honest, yes, you know, maybe when you look at me, you think of medical and that action team. But what really drove me to giving that call to Dom and saying, I'm all in, let's do this, is thriving services. My passion for youth mentoring and coaching, and you know, really just saying, wow, this is, you know, from those of you that have seen the Providers documentary, this is my Semillas de Salud program. This is a grow your own health professional program, and job training and community schools and youth mentoring. All of this fits together. And so with no further delay, let's go ahead and hear from the beautiful things that these thriving services can do.
So the sector I represent is parent support. That includes parent education classes as well as home visitation programs. It's really important, even though it's one of the thriving services, you know, obviously you need to have the survival services such as food and medical care and transportation, but parent support is one of the thriving services. And we know that if you look at what causes or what's linked to adverse childhood events, a lot of those things are dysfunctions in family relationships. So it's things like child abuse, child neglect, family violence in the home. So we know that we can prevent some of these things with parent support. If we can teach parents about child development, if we can teach them positive parenting techniques to use, it really helps them have a better relationship with their child and can help them understand why their child is acting the way they are, instead of interpreting it as being, you know, the child is being bad or the child is being defiant, just seeing it, oh, that's just typical child development, and then having some strategies for knowing how to handle that. So it's really important to provide parents that support so they don't feel stressed, so they understand their children, and they don't then behave in harmful ways to their children. Well, I just say get started. A great place, of course, is to start with reading the books and maybe having Dom and Katherine talk to your group. But the really important thing I think to stress is that so often we've been in our own little silos. So, you know, I know the parent support and home visitation people in my county, but I haven't always known the people with the food bank or the people with transportation. It's really so energizing to get together all 10 sectors and figure out how we can work together. So there's something about approaching it from a holistic perspective and again, a data-driven perspective that really excites people and can really get the message across to your local elected leaders so that they'll be supportive of this. So I just encourage you to just do it.
So the sectors I'm representing have to do with job training and youth mentoring action teams. So any local economy really relies heavily on adequate and beneficial job training, job mentorship to supply the workforce. So if we are not connected to our educational elements, our educational systems within our community, then we are missing an opportunity to join and connect the job needs with the job training. So that is one really important element as you begin to look at what the 100% community can bring to the forefront of your efforts is let's get really into the weeds on what our job needs are in the workforce and what specific job training can we look for and implement that can meet those workforce needs. And then as far as youth mentoring, every community is only as good as its systems to support children. So we must be mindful not only of our educational opportunities for children, but also those mentoring aspects. For instance, big brothers and big sisters, utilizing the services from such a great organization and enhancing those services, partnering, and putting those to work in your community so that children have adequate, appropriate, and exceptional role models, and that people have a real interest. Those who join Big Brothers and Big Sisters, for instance, they have a real passion, and those are the folks that we want to partner with our youth and our communities.
The strategies that we've primarily been using to build the job training action team is to go into our community and find the people that are already doing the work. So for instance, we have a Middle Rio Grande Economic Development Association group, and they have a workforce group. So working with them, working with the higher education and the local high school, bringing together the pieces that are very invested and building the collaboration with the idea that unity is key and collaboration and collective impact is really, really important. Yes, so a couple of examples of the impact that the Job Training Action Team has already made is kind of twofold. One of them is in communication. So there has been a lot of effort towards job training by individual groups working independently. And so coming together and communicating what we're doing has been a really important piece. And the collaboration is the second piece. So aligning our efforts and collaborating together. A recent example being working with our local high school, Socorro High School, to help make it designated as an early college high school. So that's been collaboration with the city of Socorro, New Mexico Tech, the higher education institute that I work with, of course, the school district, and it's actually being driven by one of our community members who is a small business owner. So community engagement is really prominent, and that collaboration has been a really big piece.
So something that I often think about when engaging with my colleagues in our different action teams and really looking at implementing the 100% community model in San Miguel County is something that we really have to realize and recognize that this is a plan and a model that's meant to address the long-term impact for the next generation. And I think that a realistic approach has to be had when we're looking at our work as it relates to 100% community. it's quite easy for us to say, look, we need to start acting and we need to respond. But I'll take a moment to say, this truly is taking that upstream approach and fixing the holes in the bridges, the holes in the systems that far too many of our youth are falling through. And so taking that upstream approach and fixing all of those issues and systemic macro level issues that we see is something that takes time, can be discouraging to not see immediate response or positive outcomes. But the message that I will share is that don't lose hope. This is a plan that will, fix things for the next generation of our youth. And so, with that hope and that optimism, keep moving forward. When we better prioritize our efforts to be proactive, preventative, truly proactive, our response time as far as outcomes are going to be positive for the long term. And it's a shift of mindset in how we approach adverse childhood experiences and providing the support. So my message is hope and optimism. It's going to be a marathon. It's not going to be a sprint. It's going to be a long marathon, but the outcomes will definitely be worth it for the next generation of our youth.
So here at Taos Pueblo, we saw the value of 100% community initiative in the collaboration that needed to take place and to happen. That level of collaboration wasn't happening before. And we did really appreciate and love the layered approach to addressing a single issue and having the entire community kind of focus on that one issue. As we know, the issue is childhood trauma. And here in our community programs, our tribal programs, what we're really doing is treating the symptoms of childhood trauma as an underlying issue. And our community just decided to get really serious about addressing childhood trauma. So we actually went through 2 book clubs. We held a book club here in Taos Pueblo. We got representatives from 10 different sectors here on tribal lands to engage in the book club. It happened to have been COVID and people were sent home, and computers and laptops weren't quite set up yet, and so people were able to read 100% Community Initiative as part of their work. And then we invited a couple of stakeholders from Taos County to explore the idea. We called it chewing on the model, spending time with the idea before really moving forward with getting people to the initiative. And we did that by identifying people who are already doing similar work, or people who have kind of expressed desires to see access extend to every person in the community. I've had conversations on the phone with people who I knew professionally, and I've recruited people based on Facebook posts that I saw where they expressed desire to have increased access to some of these 10 vital services. So I just reached out in an email or a phone call, talked about 100% Community Initiative, talked about what we're doing here at Taos Pueblo, and just kind of talk about the community that we'd like to see. And that's how we recruited people to our Taos County 100% Community Book Club.
There you have it. Thank you, Dr. Kim Blea, said it well. Up until now, we've been fighting with everything we have here in San Miguel County with no resources. There's been no funding. We've done amazing things with $0. It's been our time, our talent, and our treasure. And, we came out sprinting against the virus, against the pandemic, but now we've realized we have to find our pace in this marathon because this has been a long emergency and a long battle. What would really help would be resources. So if you're out there and you can hear me, please send reinforcements. Awards and medals are nice, but I prefer ammunition and reinforcements. So there's that. And for Aurora, just partner, we're losing. We're getting beaten bad by disease and despair right now. And what's happening today in Taos County is just, we're spread thin. We're spread thin. We're doing everything we can with what we have, but we're spread so thin. It's offense and defense. Defense. We've been playing a lot of defense in this game against COVID. That's about preventing infection. That's about COVID safe practices. COVID safe practices is having stingy defense. But as COVID has been breaking through those defensive lines, and now we need offense, which is access to 10 vital services, we are so spread thin. So early in the pandemic and early with 100% community, it was very warm, and I'd say, we're weaving together our services, and it's nurturing, and this is what it looks like. But I will be honest with you today, we're in the fight of our lives. And so there are 5 surviving services and there are 5 thriving services, and now it's changed because I'm making 2 fists and I'm gonna punch COVID in the face. And that's what we need. We need to fight literally for our lives and for our communities. And so I hope you will all join us out there for your own communities. All of us, we need to come together and fight for the lives of rural America. Terrell, it's a decade of Rural Health Days, and I'm so proud to be a part of it. Back to you.
Matt, you can't come back to me yet because you're making me cry. So with the joy and the fight that I see in your eyes and in your commitment and the work that you all do. And I'm just so impressed and learned so much today from hearing from the action teams and to see your spirit. I love how you refer to it also as a dance, because it is about getting people to sing off the same sheet of music and do that 2-step together. And I know that there's joy in that as you complete that work. And I know there's also agony. I want to ask you a question. We're going to go ahead and bring back in Katherine and Dom. And I'm going to ask a question of you, Matt, before I let you go, because it so goes along with what you were expressing with us. So, you of all rural providers know that the workforce is being stretched so thin. And with that said, why is it that it's critical that rural health primary care providers be in the forefront and becoming champions for 100% community? And how do you ever find the time?
Well, we have to find the time. To all of you out there, I know you're in the same boat as me. And tired. My heart hurts because, we're fighting for everyone, and not everyone believes in our fight or supports our fight, but we have to fight, and it's overwhelming. And that being said, if we're just only fighting and punching at everything that's thrown at us and not taking a minute to step back and evaluate the situation and have a strategy, we're going to lose. We need to have a strategy. And so why is it so important? Because our communities need us. And that's what we got in this for. All of you that are on this call, I know you're on here because this is your life. You've given your life to this. And we can still do a lot of good for rural America and all of America together. And we're not alone. I know I'm probably experiencing my own PTSD from the tragedies that I'm seeing, and it hasn't even started yet to be that situation where I know people are dying because they can't get in our hospitals. But I sense that that's coming if we can't turn it around here very quickly. But we're not alone. Reach out for help. If you need help as a provider, reach out for that help. We're in Aspen Grove. Our roots, you heard Aurora talk about moving upstream and identifying that common root of disease. Well, you know what? We have common roots of health, and we're in Aspen Grove. Across all of rural America, our roots are all connected, and we can do a lot of good together.
That's true, Matt. Thank you for that. I think it's a good reminder that on the Power of Rural website, there is a button with the Survive 100% Community webinar thing that you can click on to learn more about this successful strategy for 100% community. So switch gears a little bit. John, I'd like to hear from you about what do you think are, certainly Matt has talked about these personal and clinical and caring for people challenges, but what are some of the other most formidable challenges when it comes to this meaningful collaboration that you're trying to build with this framework?
Well, I've already talked about the three-headed hydras. I won't go down that road again, but I will say this, that we have been taught in rural health and in urban health in America, resources are limited. You know, set the bar low. Don't have expectations. We're always told, don't ask. And also we're told, you know, we're poor. We're just poor. Like we'll never have the money. And you know what? That era is over. 100% means that we're 100% in. And this is called limitless thinking. And this isn't pie in the sky stuff. This is let's get 20 amazing people together in a room, as Matt has done and our other initiative people have done. Get 20 amazing, limitless people in a room. And yes, there are challenges every day and it's hard, but together with limitless thinking, we're going to get to 100%. And as Matt likes to say, it's the long game. It's the long game.
It is a long day. Katherine, as Matt and we've been talking about that the pandemic has just, you know, kind of ripped us and further exposed us to that severity of the inequities that are in our rural and frontier communities. Would you talk, please, about how can 100% community be the thing that helps us go beyond these barriers and make a change and do something?
100% community, I think, is unique in that it is built and driven by and for the community itself. So it's the right size for every community because it's built by that community. And you heard our different stakeholders from across just the state of New Mexico talking about their own different takes to this initiative, but how it works in their own communities, because nobody knows their own communities better than the people who live and work and love that community. And I think you can see that when Matt talks about the passion that he has for his community members. We all have deep roots here in New Mexico, and nothing can beat that kind of passion. And I just want to point out too that all of the people that you saw speak in those videos have not received a penny to do this work. They are doing that as part of their job. They're doing that because they're driven to do it, because they care about the people in their communities. And I think that's why this model is sustainable and doable, and really has the potential to turn around these rural communities all over.
You're speaking right to one of the questions from the chat. You know, in my work in community development and in rural communities and the work of the state offices, what is it? What kind of strategies do you employ to kind of keep it going? You know, what are those connections that are necessary to maintain? What is it that keeps it updated after that initial energy? It can slow down a little bit. And when you meet a hydra, maybe it gets more, but when funding lowers, talk about those sustainability strategies that you'd recommend or employ.
Like I said, this model really works off of the passion of the people that are involved in it. And I think you're right, it does have the tendency to kind of ebb and flow a little bit. And sometimes there's a crisis and people have to pivot a little bit and focus on other things, and that's totally fine. But I think at the end of the day, as long as there's that shared vision in the community of really focusing on what matters, these 10 services, these 5 surviving and 5 thriving services for everybody, with that shared vision, the communities themselves can drive this work forward. And that is just absolutely key to making sure that this model continues. It can't be enforced from the outside. If we went in and tried to implement this in a county that didn't want it, it wouldn't work. It has to be driven by someone like a Matt or like a Cassandra in Doña County, who really have that passion and just want to see this happen in their communities. And that really builds a sustainability in, as well as the continued funding sources, which are, to be completely honest, lacking for these counties right now. but they keep going anyway because they know they have to. Otherwise, nothing's going to change.
Yes. I mean, I think one of the things that was said in the chat is there a community of practice model for rural health innovation? And where I see this, you know, my view of the world is slightly different. I work with the state offices. I see them sharing and involved in what we'll call small education and exchange and development group seeds, if you will. And I see that happening through some of the associations, but this organic work is so important. And you want to talk about, is there a community of practice, and isn't that built into your framework? Want to address that question, if you would, please, Dominic, if you would.
Gosh, you know, I'm not.
Or any of you. Sorry.
Why don't I pivot that over to Matt or Catherine? But I do want to say one thing. I do want to say this, is that what you will find when you take this on, 450 people listening here, is that when you go to city government and you go to your mayor and you tell him about 100% community, he's going to say this, or she, that's wonderful. What a great project. Good for you. It's just, you know, it's just not what city government does. We do other things, but we don't insure 10 services. And you'll hear that from county government, and county commissioners will say, we love this model, so good, thank you for what you do. But county government doesn't really insure this. We wish those services would exist. What we're pitching with 100% community is reinventing local government. It's saying local government, historically, maybe you didn't ensure these existed, but in this era, at this time, the only way in rural America or urban America we're getting to 100% is if city government and county government join us to make sure that we get there.
I love that. I think the RP folks are ready to engage with their government in that way, and that's been no truer time, I think, at least that I've been cognizant in my lifetime. Let's switch gears a little bit as we begin to wrap up and ask each of you what the power of rural means to you. So if I could go to you, Catherine.
Sure. So power of rural to me, it means everything. I grew up in a rural community, and like I mentioned, so did Matt. And I think we're here to show that people from rural communities can do anything if they set their mind to it. And we want to encourage that. And we are no different from anybody else who grew up in well-resourced cities. We have the potential, we have the desire, we just need the support. And I think that's built into our framework, and that's why we're so passionate about this model.
That's what came across so strongly in those videos from the action teams. And I love it when we bust a myth about or a stereotype of what people are like in rural America. So I love that, Catherine. Dominic?
Yeah, I think
power of rural to you?
Power of rural, I've been back. I learned the phrase, we got to think limitless from my work in rural New Mexico. So to me, it's people who are pragmatic and see where we're at and know we have to do things differently and are seeing that, you know what, we can do it. We're neighbors and we can come together. We know each other, and we've known each other's families for literally hundreds of years.
Yes, there's an old saying, if nobody knows the trouble you've seen, you don't live in rural America, right? So I think that that's part of it, knowing our trouble and being aware of our local community and our neighbors, and who better to take care of us but another neighbor. Matt, you're like, you know, poster child for power of rural, but what does power of rural mean to you?
Well, my partners here covered some of the things I would say, so I'm going to start with resilience over millenniums of people working together to overcome anything, to overcome natural disasters, to overcome, you know, whatever it is that can be thrown at us in rural America. And we're still here. We're still here, and we're forged by fire for this moment. You know, we know best what we can do with what we have and how to support each other and be there for each other. So I'm just going to end with a little story of that. I talked about contact tracing earlier, and you asked about best practice models. I'm going to tell you about Anton Chico, New Mexico, with a population of around 200 people and a county of about 4,500 people and contact tracing. So yes, we set up a testing site at our La Loma clinic there, and we are doing surveillance testing for a school that was in hybrid model and for the community. And we identified a positive case. I think that was last Thursday, a week ago. And by Friday, the community had done all their contact tracing. This was neighbors calling each other and saying, okay, this is what we need to do. And Thursday afternoon and by Friday morning, everyone had been needed to be tested was there at the clinic. And we got everyone tested. And the following week, when, again, with the larger systems of contact tracing in the state were able to get to us, all the testing had been done. All the results were already back. That's the power of rural. Neighbors taking care of neighbors. That's 100% community. And it's that thinking and resourcing that thinking that will get us through this to the brighter dawn that is to come off of this dark night we're all experiencing right now.
Thank you, Matt. That's very powerful. I'd like to come with resources and pom-poms and all of that to just cheer you all on for the good work. I want to point out to folks as we're wrapping up that this has been a special event for me personally, and I can't wait to see what happens when you click on the button that says Start an Initiative on the Power of Rural website. I also want you to know that there are other activities that are happening the rest of the week. Today at 4 o'clock, we'll hear from our friends at Stroudwater Associates with a market update that's focused specifically on rural and the power of rural for today. And also, I think you'll see in the chat a link to kind of a lineup of the rest of the resources. I want to thank Ashley Munninger and the whole team at the National Organization of State Offices of Rural Health. There's not a better team to work with every single day. They all bring their heart and they bring their minds and they bring their hands. And we're so happy to be part of this work with you all and the 50 state offices of rural health. So a couple of other things. There will be a survey that will be come up on the video before we leave, and we'd like you to please answer that survey to tell us more about how we can move work forward and how this session went with you. And we'll be emailing you too, because what you think means that much to us. So Matt and Dom and Dr. Courtney, thank you so much for sharing your heart and your mind and your good work with all of us on this National Rural Health Day. Thank you.
Thank you.